Go ahead. Okay. Good morning, everyone. Thank you all for coming. We appreciate you all being here this morning. My name is Addie Adeyemi, and I'm going to start off the presentation and then pass it over to Belinda and then Rhonda. So, as you see on the screen, just a quick overview of who we are. So we're Krowne Health. We're also Krowne Oasis Mental Wellness, and we're located in the heart of Columbia. So we're right here in the neighborhood. And we believe in providing compassionate, comprehensive care for our seniors. Our integrated approach addresses the body, mind, and soul, so helping older adults age in place with safety and dignity. As licensed providers in Maryland, we accept Medicaid and private pay options, making quality care accessible to all. Our mission is simple yet profound: to walk beside you or your loved one through every challenge of aging with dignity, kindness, and joy. So we're passionate about all things wellness, so the mind, body, spirit, as I mentioned, ensuring that we're not only taking care of our body, but also taking care of our mind. So we offer therapy, and we also offer in-home care, which we'll be diving deeper into. Now I'll go ahead and pass it over to Belinda. She'll be telling you all about the home health care.
Good morning, and as she stated, my name is Belinda, and I am the office manager at Krowne Health. So I will be providing you with a little bit of information, also about the services that we provide. So as she stated, we are right in the heart of Howard County, not far from here. You can literally walk to where our office is located, right behind the Walgreens. So we are very in the community, and we would like to do as much as we can to not only help the elderly, but also disenfranchised and also disabled individuals. So the services that we offer at Krowne Healthcare, we have skilled and then non-skilled services. So for the non-skilled services are basically personal care services. So say for instance, you would need someone to maybe do a little bit of light housekeeping, run errands for you, check your vitals, medication management, or even meal prep for you. And then we have the skilled services where if you need like a wound care services or a catheter, we will be there to also assist you. So the insurances that we accept is if you have long-term care or Medicaid waivers, and then we also do private pay. So yes, so for the insurance, we accept, as I stated, long care waivers, private pay, and then we also have Maryland home and community waivers that we or I will also guide you through into how to assess these waivers. So for elderly individuals or seniors, the community options waiver, which you have to obviously apply for it. So when you receive that waiver, it comes with a lot of perks come with that waiver, which includes personal care services. They also offer things like, and if you can flip over to the paper I handed you guys. So the community options waiver comes with assistance with personal care, which we help with ADL. So if you need assistance with bathing, supervising you while you bathe, just to make sure that everything goes well. We also have, you also receive case management, respite care, adult day program, and also home delivered meals. Okay, so we have a team of CNAs, HHAs, LPNs, and then also RNs, depending on whatever service that you need. So say for instance, you do have a wound that you need to be cared for every day, we will be sending an LPN to come and provide that service for you. But we do have a lot of diverse, speak multiple languages. We have Spanish speakers, Farsi, French, just so that we can provide, or the individual can feel comfortable, and then also be able to effectively communicate with the client. Yes, and I'm going to pass it back to Addie so she can take do Krowne Healthcare Mental Oasis.
Alrighty, so I'm back again. So as we mentioned, we also work on mental wellness. So Krowne Health mental wellness, as you see in the name, we understand that mental health is a crucial component of your overall well-being. So especially for seniors. Did you know 14% of people over 60 live with a mental disorder? Yet mental health goes undiagnosed and untreated in this population. So our behavioral health clinic serves all ages. We serve from the age of 5 all the way up to 65 and plus. We also have a special focus on seniors, and not only seniors, but caregivers and your loved ones to help you each day to give that additional support. So we provide comprehensive mental health services designed to address any unique challenges you may be facing, anywhere from depression, anxiety, dementia support, life transitions, and we're just here to ensure that quality of health. So we're proud to state that we're CARF accredited and demonstrating our commitment to quality, accountability, and the highest standard of care and behavioral health care. So we offer geriatric psychiatry, so we have a NP psychiatrist who is on site or who also does telehealth, and if any medication management is needed, she'll assess you and let you know how she can help in those ways. And then we also have therapy services, anywhere from depression, anxiety, grief counseling, retirement, maybe you just need someone to talk to, maybe you're dealing with illnesses, maybe you're just having stress, just need help with stress management. We have licensed therapists that can come out and provide you with resources, either coping skills or just different resources that you may need to make sure you're successful in your mental wellness. So we offer in-person therapy, and we also have telehealth where you can just click a link from your phone or your laptop and see a therapist right in the comfort of your home. And we also offer group therapy, which is senior-friendly therapy circles, building friendships and resilience together, talking about some situations that you're dealing with, and your therapist can kind of give you advice, give you resources to use within those sessions as well. So here we're talking about understanding geriatric therapy. So geriatric therapists specialize in providing mental health care tailored to older adults, addressing issues related to aging such as social isolation, grief, dementia, anxiety, and much more. We work collaboratively with your family members and medical professionals just to ensure you have that comprehensive care, because once again, our goal is to ensure that we're well all around, mentally, physically, emotionally, spiritually, etc. So these specialists play multiple crucial roles in supporting older adults' mental well-being, from assessments to diagnosis to providing therapeutic approaches, creating a treatment plan, and if medication management is needed, our psych NP can also provide that. So just a quick breakdown of the process. First, you get assessed and diagnosed by your psych NP and the licensed therapist. Then we set you up with a counselor who will provide therapy sessions with you. We offer counseling, psychotherapy, and cognitive therapy, and that therapist will also help you build a treatment plan to match whatever you're dealing with. So if you're dealing with maybe loss, they'll help you find ways to grieve, give you coping skills, and you guys work together in a person-centered approach to create your therapy plan and to make sure your therapist and your sessions properly help you. We also help support caregivers, so work with family members to improve their ability to support aging individuals. So if they also need someone to talk to, we can also give that support where you guys can do a family session or they can have their own individual session as well. And then we like to collaborate with professionals, so we'll ensure we're coordinating with your doctors, any social workers, or any other healthcare providers that can be successful in helping your mental wellness as well. And then lastly, we help navigate end-of-life issues. So we assist with addressing the end-of-life decisions and any final stages of life. And just be that continuous support to kind of help you get whatever situation you're dealing with, or if someone you know is dealing with that situation, we can be that support to kind of talk you through it. Switch over, please. And then insurance and eligibility. So Krowne Health is committed to making mental health service access. We have Cigna, United Healthcare /Optum, and then the Veterans Affairs insurance, and then we also accept all Medicaid as well. So if there's a service you're interested in, those are some options. And we also have self-pay options as well on a sliding fee scale that kind of matches whatever your income is, to make it easy access to you. And then lastly, on my part, so basically our team is made up of licensed therapists. So we have LCPCs, which I am a licensed clinical professional counselor. We have LGPCs, licensed graduates, who are supervised. We have LMSWs and LCSWs as well. So we have licensed social workers and licensed therapists, as well as our psychiatric nurse practitioner on board to assist. And lastly, we just work with each professional is dedicated to just delivering that compassionate, person-centered, and evidence-based care to ensure that it's tailored to the unique needs of each individual that we serve. We work together to ensure a holistic approach to mental wellness, integrating clinical expertise with empathy and cultural sensitivity. So yes, that's the main part of Krowne Oasis. So as I mentioned, we're just here to ensure that you all are well mentally, physically, emotionally, in every aspect of your life. And so we're going to pass it over to Ms. Brownley to round it up.
Let Belinda just round it up.
Okay. Oh, and I'll just round it up.
Okay.
She has.
Go ahead.
So additional elderly support services. So based on global trends and recommendations from the World Health Organization, we proudly support or collaborate with partners to provide essential services that seniors increasingly need. These comprehensive supports address the social, creative, and safety needs that contribute to overall well-being. From reducing loneliness through social engagement to ensuring physical safety and providing respite for caregivers. These services complement our core offerings to create a holistic support system for aging adults and their families, caregivers, and anybody else supporting you. So, partnership built for wholeness. So together, Krowne Oasis and Krowne Health work to create a comprehensive care system that addresses every aspect of the senior well-being. Krowne Health supports that physical health through home care and sending in aides to help you with all the ADLs and everything else that she mentioned. And while Krowne Oasis helps you champion any mental and emotional balance through specialized therapy, treatment plans, and support programs and groups. So we're here to walk beside you or your loved one through every challenge of aging with dignity, kindness, and joy. Contact us today to learn how we can support your journey towards a wholeness and well-being. So we're here for the body, which is the physical care and support services, for the mind, which is the mental health and cognitive support, and then for the soul, emotional well-being and fulfillment. And the last slide just shows a little bit of our team being in the community. So we love to we love Howard, we love being in the middle of Howard, we love being in Columbia, so we're always out and about volunteering together, offering home care support, doing mental wellness outreaches, community engagement, and you can slide up a little bit. And then serving the community and community care in action. So like we said, we love Howard, we're just here trying to support as much as we can, whether it's volunteering in whatever programs you have going on or offering you the support that you need through in-home care or therapy. And that's all we have for today. Thank you all so much for listening, and if you have any questions, please let us know.